So looking at the next pregnancy terminology, we are looking at what is known as hyperemesis gravidarum. So what does hyperemesis gravidarum actually mean? See, hyper means if something is so high, hypertension, right? Hyperactive. Emesis is a medical word for vomiting. So if I say hyperemesis, that means the person is vomiting too much. Alright, gravidarum is a word used for somebody that is pregnant. So fixing everything together, this person is vomiting too much and this person is pregnant. So let's discuss it. It's a severe form of nausea and vomiting. Nausea is like you are feeling to vomit, while vomiting you are actually vomiting. So it's a form of nausea and vomiting during pregnancy. It goes far beyond the typical morning sickness. It can lead to dehydration. Why? The woman is losing a lot of fluid as she's vomiting. Do you understand? So she's losing water, she's losing electrolytes, all those chemicals in the body that will help your body to function well. So she's becoming dehydrated. As a result of that, she's losing nutrients. So she's becoming weight loss, she's losing weight. All those chemicals are not balanced anymore, so there's electrolyte imbalance. All right, in some cases she might even require hospitalization. All right, so key symptoms is what? There's persistent. The feeling to vomit and the vomiting is for a very long time, right? More than 3 days. So these are the questions that a medical professional will be asking the woman when you start vomiting. They are trying to check the timeline. Okay, so there's inability of the woman to eat food, and the food will stay. It will always come out. All right, weight loss for more than 5% of pre-pregnancy weight. So your weight before the pregnancy, you have lost weight so much. The woman is dehydrated. So during physical examination, they will ask her to open her mouth. They are trying to check the mucosa, if it is fresh or dehydrated. All right, she's dizzy. If you ask her to stand up, she don't want to stand up for a long time. All right, then you ask her how many times has she urinated today. She might just tell you 1 time in an afternoon, which is not good. She's weak. She's having headaches. Sometimes she's fainting, and if you ask the husband, she's giving him a lot of drama. So in extreme cases, you can see her eyes are becoming yellow. That's jaundice. Confusions, even Wernicke's encephalopathy. Those one is just rare things. So possible causes. The exact cause isn't fully understood, but there's a strong link to human chorionic gonadotropin. Is a hormone that usually rises in pregnancy. So that's the hormone that is causing those problems. Other factors, if the woman is actually vomiting so much, maybe she has twins, right? Molar pregnancy. Maybe the pregnancy is in a different place other than the uterus. There are different places for pregnancy, right? Then sometimes if you ask her, did your mother tell you that when she was pregnant she used to vomit like this? Do you have elder sisters? Do they have the similar problem? It could just be that it's a family thing. Then sometimes you ask her, is this your first time being pregnant? So first pregnancy, there's usually so much problem. All right, but the woman, when she becomes old soldier, all right, she can be pregnant and she's doing all that thing, nothing concerning her. So treatment options is just rest. They will advise you on what to eat. Right, you can be taking ginger, vitamin B6 things. Then they will give you some drugs that are against vomiting, anti-nausea drugs. Right, then that's mild cases. So moderate cases, she has lost a lot of fluid, so you have to rehydrate her. So intravenous fluid, they might now say, we'll admit your wife for a while. They'll put some 1 or 2 fluids for her just to replace the fluid she has lost. Electrolyte replacement, vitamin replacement. They give some medications like metoclopramide, antihistamines. All right, then nutritional support, where they can now be feeding her through a tube that they put in the mouth or the nose. So you should just know that vomiting is just one of the signs of pregnancy. So other signs, she's dizzy, mood swings, frequent urination. That's why she's not vomiting, because If you are vomiting, you lose a lot of fluid, you know. She has missed her period. There's increased sensitivity to smell. She's easily being irritated. She's tired, you know. Her breasts are tender, you know. So coping tips: she should eat small, she should eat frequently, she should avoid any triggers like strong smells, you know. She should stay hydrated with sips of electrolyte rich fluids. Use acupressure wristbands or try relaxation techniques. Okay, so that's it for this beautiful concept in obstetrics.